Welcome everybody. Very exciting. Today is one of our first Let's Talk Tuesdays. We're going to do this weekly, and if it's hopefully this is really informative for all of you too as well. But this is some questions and answers that we'll get through each week. We're going to talk about a different topic that pertains to us here in our practice. And but just introduce myself here today. I'm Dr. Scott Schlueter. I graduated from Southern Illinois School of Dental Medicine, and then went into the Air Force and practiced general dentistry along with doing an advanced residency in the military. I got out of that and went to University of Texas Health Science Center in San Antonio, where I received my degree and master's in oral biology and my certificate in periodontology specialty. I'm dual boarded, which means I'm boarded not only in periodontology but also in implant dental surgery. And that's something that we're going to talk about today. I'm very excited, something that we do in our practice a lot. And a lot of you may be a little bit familiar, maybe not as familiar with dental implants. And essentially, a dental implant is not this thing, but it's actually this. This is the actual dental implant. Now, we use the largest, or one of our main implants that we use in our practice is produced and made by the largest implant company in the world. So they have a high reputation, high level of success rates, and that's why we use those along with some other ones that we use too, which are extremely popular and good too. So it's not just one fits the keyhole, if you will, but we also deal with a lot of periodontal surgery stuff, which we'll get into as we go through the weeks and stuff, so it'll be kind of cool, that. So the actual dental implant is this hollow titanium screw, and this is allowed to integrate in the bone, and then there's a post and a crown, which is typically done by your general dentist, or if you don't have one, that we can certainly set that up for you with a very good well-experienced dentist. But they make this crown and post that permanently screws down inside the implant. Something that we do uniquely here is that we have a lot of technology in our office, which allows not only it's cool, but more importantly, we can offer and deliver very high-level predictable treatment from start to finish, meaning cone beam imaging, which is a CAT scan type imaging, which allows us to see three-dimensionally, and we'll show that as time goes on. So that really allows precision, not only with selecting the type of, if necessary, bone regeneration has to be done. Yes, we can grow bone. We grow bone every day. So when people say, I can't get an implant because my dentist told me I don't have bone, well, I don't think that's usually the case. Honestly, they may not know what technology and limitations there are because they don't do that necessarily. So I encourage you to see someone who is well versed in this. We'd be more than happy to check you out and see if you are a candidate, which most people are candidates with that. The other thing that I offer is sedation. So let's say you're nervous about it. I'm one of the only periodontists out there that we do IV moderate constant sedation. We place a line in the crook of your arm and place medications through there, like if you had ever had a colonoscopy. That's similar to that kind of context. So, that allows you to really be there but not be there, if you will. So that's really nice too. I've been doing implants for over 15 years here in this practice. And that we always follow up with all of our patients, and this is something unique that we do in our practice. I will say that I can't say for everyone, but I know for sure that there are a lot of surgeons that there is minimal follow-ups with that. And I mean, once you get the crown on, we offer complimentary follow-ups and x-rays, analyzing and making sure that everything has properly been done, not only in our practice, but in the dentist office too. And we follow along for at least 2 years complimentary. So I think that's very important, so we can curtail issues that may have been overlooked previously. We'll kind of get into some basics with this. We'll do that right now. And again, the cone beam imaging really allows us to see things. That's why it's very important, and we're offering right now actually a free CT scan in any implant dental consultation. So remember to ask for that when you do call to schedule an appointment. This allows, like I said, accuracy and precision in determining the appropriate treatment plan for you and answer any questions. And a thing that I've noticed over a decade as I've been using this imaging technology is that it allows you to visualize the situation. And we sit and I take the time to go over that stuff with you and make sure that we not only know our part, but all the way from start to finish, so that there are no expected or unexpected surprises, not only in cost, but treatment. So there are a multitude of different procedures or types of restorative implant treatment that can be done. There's the single implant, which is really nice, rather than a bridge where, let's say, you're missing a tooth right here, and the dentist maybe, an option can be is that the other two adjacent teeth are cut down, and to replace that tooth, well, they just put a fused tooth with 2 caps on there. And it looks great. Unfortunately, the length of the time is less life expectancy, almost around about 82% after about 10 years. Rather than, what needs to be redone with this is decay happens, cavities happen, and you have to have this thing removed and cut down further each and every time. Plus much more difficult to clean underneath this bridge. So that is something why we don't want to touch the adjacent teeth, especially if there's really been nothing hardly done on them. And we just have a single implant, so it's not affecting the adjacent teeth. This can also be done, let's say, like I just said, this is a bridge. So if we had just picture 2 dental implants here and here, and this could be fused together. So we can save costs with minimizing the number of implants. 2 implants could maybe take up a span of 4 teeth, even up to. So that's kind of a nice attribute. Do we have any questions or anything from the audience?
No.
Okay, good. So the other thing that we have is a total arch dental solution. And this is something that if you're missing all of your upper or lower teeth, implants can be done to affix a prosthesis so it doesn't come off, and flap around your mouth. And you don't have to use adhesives, and you get your function back to 90–95%, which is a really nice way to facilitate a full arch solution with minimal cost, along with something that can be completely fixed in your mouth that is professionally removed. This is what they call all-on-4 type thing, all-on-5. But this is something that the professional will, in our office, we will periodically unscrew this clean out from underneath there. But this is not something that comes in and out of your mouth at all. But these are some options that are things that we do. We do a multitude of different implant technology, and I welcome you to come try us out. I know you like us, but again, I sometimes talk a lot. So, but is there nothing else? So, but I appreciate you all attending, and we will see you next week. Thank you.